first-year anatomy students to this explainer. Okay, I want you to think of the human body for a second, not just as a biological organism, but as a literal, incredibly complex, three-dimensional map. And just like any explorer setting out to chart unknown territory, medical professionals absolutely need a reliable navigation system. You can't just point and say, the pain is over there, or tell a surgeon to make an incision a bit to the left. That doesn't work. You need universal GPS coordinates. The early anatomists who first defined these terms for their gross anatomy studies knew that to map the body safely, they needed a rigorous, standard classification system. So today, we're going to learn exactly how to read and navigate their medical map, ensuring that no matter who is looking at a patient, an X-ray, or an MRI, everyone is oriented in exactly the exact same way. So here is our agenda for today. First, the universal starting point. Second, drawing the grid. Third, the anatomical compass. And finally, surface to deep layers. Let's get right into it.
Section 1, the universal starting point.
All right, to kick things off, we really need to define what we're actually doing here. Anatomy is, at its core, the scientific study of the structure of the human body and how all those parts relate to one another. But to study those relationships accurately, we have to assume our patient is in what we call the standard anatomical position. Picture a person standing straight up, but crucially, their arms are resting right down by their sides with their palms facing anteriorly. That means the palms are facing directly forward. It doesn't matter if your patient is lying in a hospital bed or sitting in a chair. Whenever we use anatomical terms, we are mentally referencing this exact specific standing posture. But of course, patients aren't always just standing there, right? So let's anchor these concepts by looking at the two most common resting positions and their exact opposites. On the left here, we have the supine position. That's when the patient is lying down, face up, looking toward the ceiling. On the right, we've got the prone position. That is when they're lying on the examination table with their face directed down toward the floor. So supine is face up, prone is face down. Whether you're examining someone or prepping for a procedure, these are going to be your two most foundational terms. Now, this is wild. Look closely at what actually happens inside the body when we switch between these two positions. Check out the forearm bones. When the palms are facing forward or upward in that supine position, those two bones, the radius and the ulna, they sit perfectly parallel to each other. But when a patient flips their hands over into the prone position, the radius and ulna literally cross over one another. It's a physical, structural shift based entirely on body position. And honestly, that's exactly why having that baseline standard anatomical position is so absolutely crucial. Moving on to section 2, drawing the grid. So, our anatomical descriptions are built on 4 imaginary planes that intersect the body while it's in that standard position. Think of these like the literal grid lines you'd see on modern medical imaging, like CT scans or MRIs. To picture how this works, imagine taking a kitchen knife to slice an apple, or maybe a loaf of bread, from a few very specific angles. We've got the median, sagittal, frontal, and transverse planes. Let's see how they slice up our map. First up is the median plane, which you'll also hear called the midline. This is a vertical plane that passes straight down through the exact center of the body. It perfectly symmetrically divides the body into equal right and left halves. This plane gives us the absolute midline of the head, the neck, and the trunk, right where it intersects the surface. Next, we've got the sagittal planes. Now, these are also vertical planes, but they pass through the body parallel to that central median plane we just talked about. And this is a great illustration of how we can actually have multiple sagittal planes. If a sagittal slice runs perfectly parallel and super close to the median plane, we call it a paramedian plane. So while there is only one true median plane, you can take a sagittal slice literally anywhere along the left or right side of the body. Then we have the frontal plane, which is also known as the coronal plane. This is another vertical cut, but it passes through the body at right angles to the median plane. Essentially, it divides the body into an anterior or front part and a posterior or back part. But here is a fascinating little quirk to keep in your back pocket. A transverse cross-section of the foot actually lies in the frontal plane. Because the long axis of the foot runs horizontally, its orientation totally defies the standard vertical logic of the rest of the body. And speaking of transverse, that brings us to our 4th primary plane, the transverse or horizontal plane. These sections are slices of the body cut at right angles to the longitudinal axis. For example, right here you're seeing a cross-section of the mid-left thigh, looking upwards. You can clearly see that femur bone sitting right in the center, wrapped in muscle. This horizontal slice gives us this really incredible top-down or bottom-up view of the internal structures. But hey, reality is rarely perfect, right? So, a crucial point for all you future clinicians is that real world radiological images don't always line up perfectly with these strict sagittal, frontal, or transverse planes. A lot of times, they are slightly oblique. You get a diagonal cross section anytime you slice the body in a plane that isn't perfectly longitudinal or perfectly horizontal. But understanding the strict grid first, that's what's going to help you make sense of these messy, off angle, oblique slices when you're dealing with real patients.
All right, section 3, the anatomical compass.
Let's figure out our vertical up and down directions on this human map. Superior refers to any structure that's nearer the vertex, which is the absolute topmost point of your skull or cranium. And the exact opposite is inferior, meaning a structure situated closer to the sole of the foot. So pretty simply, your shoulders are superior to your hips, and your knees are inferior to your abdomen. Now, a closely related set of terms is cranial and caudal. Cranial just means towards the head. Caudal, on the other hand, means towards the feet, or the tail region. And there's a really fascinating evolutionary callback embedded right here in our medical language. Caudal specifically refers to the coccyx, or tailbone, that little bone at the inferior end of the human spine. It literally represents the human tail region. Next up, navigating front to back. Anterior, which you'll also hear called ventral, means toward the front of the body. For instance, your sternum, the breastbone, is anterior to your heart. On the flip side, posterior or dorsal refers to the back surface of the body. To really lock this in, just think about your head. Your brain is positioned perfectly posterior to your forehead.
Section 4, surface to deep layers.
When we start venturing inward from the outside world, we rely on the terms superficial and deep. I want you to picture a surgeon making an initial incision. The superficial structures are what that scalpel hits right away, near the outer boundary of the body. So your skin is superficial to your muscle layer. But as that surgeon explores further down, they reach the deep structures. The muscular layer is deep to the skin, sure, but remember, it is still superficial compared to your intestines. It's all about relative relationships as you travel through the body's depths. Once we're actually deep inside those body cavities, we need a way to differentiate the linings of our internal organs from the linings of the cavities themselves. For all you first-year students, here is a rock-solid memory hack, straight from Latin. Visceral comes from the Latin word for internal organs, or flesh. Parietal, meanwhile, comes from the Latin word for wall. Let's see how this plays out with real structures in the abdominal cavity. The stomach is a viscus, an internal organ. Because of that, the protective lining that tightly hugs the surface of the stomach itself is called the visceral peritoneum. On the other hand, the lining on the inside of the abdominal cavity wall, the actual container holding those organs, is called the parietal peritoneum. Just remember, visceral hugs the organ, parietal lines the wall. It's that simple. All right, we've covered the fundamental language you need to map the human body. Everything from the standard anatomical position to our specific slicing planes, right down to the compass of superficial and deep. But I want to leave you with a bit of a provocative thought as you step out of the textbook and into actual clinical practice. If a medical image is taken on a messy, slightly oblique angle, one that doesn't perfectly align with those nice, clean, transverse or sagittal planes we talked about, how are you going to mentally reorient your anatomical compass to read it accurately? Navigating this human map means you really have to know the rigid rules, just so you can dynamically apply them when reality bends the planes. Keep studying that map, and I'll see you in the next explainer.